Excellent. Hi, everyone. We're going to go ahead and get started here. So for today's talk, we are going to be talking about ketogenic diet for epilepsy. And our program is titled Uncovering the Truth Behind Ketogenic Diet for Epilepsy. And Brad and Candy are so wonderful about bringing different centers together and getting us to all talk about different topics, and I think that's wonderful. And so today, I'm joined by two amazing dietitians from other ketogenic diet programs. My name is Beck Reyes. I am a pediatric nurse practitioner at UCLA Mattel Children's Hospital, and I work with dietitians in our pediatric program. But as of late, I've been fortunate to have adult patients on ketogenic diet as well. And so it's great that the word is getting spread out there about how effective ketogenic diet can be for epilepsy. So I'm going to go ahead and I'm going to allow my great colleagues here to introduce themselves and we'll get started.
Hi, I'm Rebecca. I'm the ketogenic dietitian at Stanford Children's.
Hi, I'm Sarah. I am a dietitian over at CHOC Children's, just across the way. So we thought we would try to make it fun by doing a little bit of true and false with our audience. So our first question is, ketogenic diet therapy has been around for 100 years. True or false? True? One false? The answer is true. So the ketogenic diet has been around for quite a while. Fasting has been documented as a treatment for seizures since biblical times. So Hippocrates, Galen both have documented about it. I think it was also in the Bible as saying fasting and prayer can be a method to help with seizures too. But really, it was in 1921 that it was first documented in medical journals. So fasting as a treatment was documented in the Medical Record Journal, and then in the Mayo Clinic Bulletin, there was another documentation about a high-fat, low-carbohydrate diet can be used to help control seizures too. Really after that, ketogenic diet became a little bit more popular, and then it went down a bit when the MCT oil diet was created because it could cause a little bit of GI distress and everything. And then we went back up again when the Charlie Foundation was founded in 1994, and we got a lot of PR, and then we had a film called First Do No Harm that was created by Jim Abrams, one of the founders of Charlie Foundation, and that starred Meryl Streep. So we got a lot of street cred from there, and it really has taken off since then. So, I just kind of wanted to talk about what the ketogenic diet is. So, ketogenic diet at a glance is going to be a high fats, adequate protein, and a really low carbohydrate diet. It is a medically supervised diet, so we do talk about this in the form of that this is a medical ketogenic diet. It is an effective treatment for epilepsy, and it's typically used as the next line of treatment after about 2 to 3 anti-seizure medications have been trialed and haven't been successful yet. So, our next question is, ketogenic diet therapy is a treatment option only for children. True or false? False. Correct. Ketogenic diet can really be used for all sorts of ages. So we use it for our infants, we use it for children, and we can even use it for adults, just as how Beck was talking about. What we do know is that ketone production can vary, and we do know that ketone production may not be as great with our adult population. So, next question. Ketogenic diet therapy is only 20% effective. True or false? False. Correct. So we do know that ketogenic diet therapy is beneficial for about 2/3 of our patients, so about 70% of our patients. A third of these patients can have a 90% reduction, with half of those becoming seizure-free. Another third of those children may have an over 50% reduction in their seizures, and then there is another third that may not be able to get enough benefit from the diet. That third not getting enough benefit, really, families' choice of discontinuing the diet because of logistics, social economical issues, or they're just saying that it's not benefiting in terms of seizure control. We do know, as of the 2018 consensus guidelines, that there are a number of epilepsy syndromes that have an over 70% benefit. So that's our table 1 on the right-hand side, right here. And then in general, we do know that other conditions too, listed here in table 2, also benefit from the diet with that average 50% reduction in seizures. Next question. Ketogenic diet therapy changes the body's metabolism and main source of energy. True or false? True. Good job, everyone. So we do know that there is a switch in metabolism when we're switching from our normal, typically American diet over to the ketogenic diets. Basically what happens is that we create the state of nutritional ketosis, and during that process there's something that happens called fatty acid oxidation. So basically the fat that you guys are eating will be metabolized through fatty acid oxidation inside the liver to produce something called ketone bodies. Ketone bodies are an accumulation of beta-hydroxybutyrate, acetoacetate, and acetone. We also see that there is a decrease in blood sugar levels too. So in this picture right here, you could see that this is the metabolism where there is fatty acid oxidation happening in the liver, right here. And then there's a production of acetone and beta-hydroxybutyrate, which transfers over to the brain because the brain can use that as another source of energy. So we have acetone, acetoacetate, and beta-hydroxybutyrate being used in the brain versus glucose. So really, again, there is a switch in metabolism. So what this graph shows right here is a patient starting on the ketogenic diet. So you can see the two main lines, this light blue line right here and this green line right here. The light blue line is going to show ketones, and then the light green line will show glucose. So you can see that there's an inverse relationship between the two, and really we're going from no ketones to producing ketones, and then the blood sugar level drops and evens out. So both of these even out when the patient becomes truly on the ketogenic diet. So next question, 2 questions. This is the same diet that my friends are on for weight loss, and I can follow the ketogenic diet according to what I found on the internet. True or false? False. I have a very smart audience today. It is false. So we know that calories are not restricted on the diet, and our goal is never for weight loss on the diet. Really, the majority of calories are coming from fats, and this is not a high protein diet. So typically what you find on what I call Google Keto is that people are encouraging fat. It is a low carbohydrate diet, but we're pretty much replacing that carbs with protein. And that's not the case on the medical ketogenic diet. We don't want the high protein because that can actually inhibit our ability to get into better ketosis. So really what we're aiming for is, again, majority of our calories coming from fats, a moderate protein diet, and a very low carbohydrate diet. What that can look like is this pie graph over here. So you can see 90% of the calories can come from fats, 6% can come from protein, and 4% can come from carb. Another fact about the ketogenic diet, or the medical ketogenic diet, is that we are very strict with sugar alcohols. So popular sugar alcohols right now, including sorbitol, another one, allulose, and all of those things, we typically do not allow them on our medical ketogenic diets. We only allow, at CHOC, we only allow subtraction of one particular sugar alcohol. So, next question. There is only one way to do ketogenic diet therapy that is effective. True or false? False. Great. There are many ways to do the ketogenic diet, and really the idea of it is that your ketogenic diet team will help customize your diet and type of diet based off of what we see best fits you and your family. So, in general, there are 5 main ketogenic diets that are outlined. The first one is the most popular. It is the classic ketogenic diet. It is prescribed in ketogenic ratios, so that's your nutrition prescription, if you will. And you are using a gram scale to prepare all of your foods and meals. The next diet is a little bit more liberalized. It's called the Modified Atkins diet, or MAD for short. And basically on this diet, you're only tracking net carbohydrates using typically different phone apps like Carb Manager or MyFitnessPal or Chronometer. And we give a net carb prescription, so that's your nutrition prescription. Typically it is between 10 to 30 grams of carb per day. Another version of the diet is called the Modified Ketogenic diet, and you can think of this one as a hybrid of the first two. So we are using ratios to help control the nutrition prescription. So here you can see we're at a 1:1 to a 2:1 ratio. But really we're also using those phone apps again to really track all of the macronutrients. So instead of just counting carbs on the Modified Atkins diet, you're counting your fat, your protein, and your carbohydrates. Another version of the diet is called Low Glycemic Index Treatment, or LGIT for short. This diet basically allows more carbohydrates, so you can see there's a 40 to 60 gram carb amount allowed per day. It is high fat, so it is 60% fat, but we are aiming for all types of carbs that have a glycemic index of less than 50. And we'll teach you all about that if you start on that particular diet. The last diet is called the MCT oil diet. It is high in MCT, so about 30 to 60% of your calories would be coming from MCT oil specifically, and it does allow higher carb intake. The other version is really a combination of all of them. We'll take questions at the end if that's okay. Thank you so much. So we can do a combination on any of these, and really your dietitian and your keto team will help pick all the best pieces of all the different types of diets to make sure that we pick the one that you guys can succeed in. So I'm going to pass it over to Rebecca.
All right, so I do want to kind of show everyone what a keto meal would look like. So this is a quiz. I want you guys, I'll show you a set of pictures and tell me whether or not you think it's a ketogenic diet meal. And I'll tell you what's on it. So this is a Buddha bowl. Oh, sorry, other way. All right, so it has lentils, sweet potato, avocado, curry chicken, mushrooms, tomatoes, and spinach. Is this a ketogenic diet meal? Perfect. So why is it not a ketogenic diet meal?
Sweet potatoes?
Perfect. So the sweet potatoes and the lentils are what will provide a lot of carbs, which will not fit as a ketogenic diet. So this one is seared lamb steak with grilled asparagus. Is this keto? Oh, I heard some yes and no. So this is actually a yes. As you can see, the seared lamb is actually a pretty small portions, and you can literally count the stalks of asparagus that you can have. And the pool of oil at the bottom shows you that this is actually a lot of fat. So this is actually a recipe from the Charlie Foundation. This plate is a 2.5 to 1 ratio. Okay, so the next one, this one might be a little bit more tricky. This is a pork chop topped with cheese, served with 2 different sides. So one is grilled squash and tomatoes, and the other one is the red bell peppers, olives, kale salad with olive oil dressing. Is this keto? No? Yes? So this can be a ketogenic diet meal. To get it right. So all of the vegetables on here are very low in carbs. The portion sizes of the pork chop is relatively small, and it really depends on how much olive oil you put on this plate that can really adjust your ratio. Okay. So basically what I wanted to say is ketogenic diet may not look the way you think. Okay, so there's even desserts on these on this picture, and all of these comes from the Charlie Foundation. And a lot of the times when we think about keto, we think, oh, no more dessert. So I want you guys to remember that there is a group of people who are working very, very hard to make this diet more tolerable and help patients kind of manage their sweet cravings. So I highly, highly recommend that you guys check out Charlie Foundation, KetoCal websites for recipes to help you be on the diet. Okay, oh, this one just came out of nowhere. Okay, so this is avocado chocolate truffles. Is this keto? Yes, so this is very keto. This is a 6.25 to 1 ratio. So you can even pair it with a fruit to go with it. And this is also from the Charlie Foundation. All right, so another true or false. My child cannot be on ketogenic diet if they have a feeding tube. Perfect. Very smart audience. So feeding tube is actually associated with better tolerance and higher adherence rate. And we do carry a variety of ketogenic formulas, so even if you're plant-based or your child is on a peptide formula, that's something that we can accommodate. And if you work really closely with your dietitians, they can also help you transition to blended feeds if that's something that you're interested in. So typically for tube-fed patients, we initiate them in the hospital, and this is gonna be a rapid start. So within a week, you'll reach ketosis and you'll reach your goal. So the reason why we do it inpatient is we wanna make sure that we're managing any low blood sugars, any side effects, and and this is like a perfect opportunity for your dietitians or your team to come and stop by every single day and teach you how to manage the diet at home. Okay, so due to COVID, I think a lot of centers have started incorporating outpatient initiation, but just be mindful that it is going to be slower and you're not going to be done within a week, so it'll probably take you a couple months to get to your goal. Another true or false, babies can be on ketogenic diet too. True? True. So, as I've said, we have ketogenic diet formulas, and these are drinkable. They come in vanilla, they come in chocolate. I wish they come in strawberry too. They do have a lower ratio goal just because they're at a higher risk of developing low blood sugars. And we can support breastfeeding with ketogenic diet. So typically we do this by providing ketogenic formulas at a higher ratio before or after breastfeeding. We also welcome moms to pump, and we can mix those with ketogenic formulas to get to the ratio that they'd like. Purees can also be made keto friendly by mixing any type of baby food with fat source like butter or oil. And formulas can also be adjusted while your baby is starting finger foods. So that means the formula is going to be higher in fat to accommodate what the baby is eating. Okay, true. This passes to you.
Great. I was getting hungry just looking at all of those delicious keto meals. I think, 10 years ago, ketogenic diet was stigmatized because it was this really gnarly diet that you had to be on if you had epilepsy, but it could be effective. And having keto for weight management has kind of been a blessing and a curse for those of us that have been managing keto for a long time, because it really popularized ketogenic diet, but also made a lot of folks think that it's really easy to do. But it also gave us the opportunity to look at different ways that we can make ketogenic diet palatable. So not, it's not just plain fat. It's not just drinking oil and eating butter all day. There's all sorts of ways that we can still do this diet and it can still be palatable and effective for seizure management. So the next true or false question is, this is a natural treatment that can be used to replace medications. True or false? Maybe? I know, I'm waiting to see the answer too. So it is, so both, right? So ketogenic diet can be used in conjunction with some of your other therapies. So you or your child might be on anti-seizure medication. You might have recently had surgery, you might have had a device that was placed. What's important to note is that keto can be added on or it can be used on its own for treatments. There are a couple of types of disorders where ketogenic diet really is the gold standard for managing those types of conditions that lead to epilepsy, and that's pyruvate dehydrogenase deficiency, GLUT1 deficiency. And so if you or your child have either of those conditions, then really ketogenic diet is the gold standard for those conditions, and you may or may not have to be on anti-seizure medications. For some folks, they might have to use keto in conjunction with anti-seizure medications, and sometimes you might require a device or you might require surgery. I think really at the end of the day what matters is getting to as close as a number 0 as possible. So if you can be on the least amount of therapies with the least amount of side effects, with the least amount of seizures, and that's the combination that you want to aim for. But you can use it in combination or on its own, really depending on what's going on with the seizure activity. Keep in mind that ketone-producing diets are not nutritionally complete. So I have families that maybe come to us and say, well, I want to reduce the number of pills that my child needs to take. And so I want to go on diet therapy. So if you're thinking about starting a ketone-producing diet, it's important to note that it's not a nutritionally complete diet, meaning that we'll have to supplement some things, meaning that you or your child might have to be on a multivitamin, and it might have to be a specific carb-free multivitamin. We might want to replace some calcium as a supplement. We might need to give some vitamin D. So while you can use food as a treatment for epilepsy, it's not without pills. It's important to keep in mind that we may have to supplement some of those trace minerals and vitamins because it's not a physiological diet and it's not nutritionally complete. And so, ketogenic diet, as with all of our anti-seizure treatments out there, don't come without possible side effects. And so there are some side effects associated with ketone-producing diets, and you might have to be on medications to manage the side effects that are associated with ketogenic diet. And we'll talk about that in just a little bit. So true or false, I must be on anti-seizure medications prior to starting ketogenic diet.
False.
So interestingly, so to traditionally be able to start a ketogenic diet, we have to establish that you have or your child has medically refractory epilepsy. And by definition, that typically means failing 2 or more anti-seizure medications, with the caveat of there are those 2 conditions that I had talked about where the gold standard is ketogenic diet, then typically that's first-line treatment for those conditions. But usually before actually starting a ketone-producing diet, we need to make sure that you are actually medically refractory. And so if you start a medication, doesn't work, you try another medication, doesn't work, then certainly at that point, you or your child would be eligible to start a ketogenic diet. But like most things, there is a gray area. So, it's important to talk to your neurologist, epileptologist, healthcare team, if you could start a ketogenic diet. And most importantly, if we're not hitting it home right now, it's important to be managed by an epilepsy team, a ketogenic diet epilepsy team that really manages these types of diets. I certainly, and I'm sure my dietitian colleagues have had families that have come to us. They had tried something that they had seen on the internet or had been advised by family members on how to do the diet. And while, yes, maybe their child had gotten ketotic, it may not have been the safest way. So it's important to be managed by a ketogenic diet team. Okay, so true or false, ketogenic diet interacts with anti-seizure medication. So mostly false. So Studies on the pharmacokinetics of anti-seizure medications during ketogenic diet have found that serum levels with the most commonly used anti-seizure medications don't appear to be significantly altered. And so, you might hear of some drug-drug combinations, Epidiolex, clobazam put together, it might skyrocket one level or the other. So it's important to note if you're on ketogenic diet with these commonly used anti-seizure medications, there won't be any changes in the serum levels of those anti-seizure medications. There are a couple of medications that are classified as these carbonic anhydrase inhibitors, so topiramate, zonisamide, they're probably the more common ones that we use to treat seizures. So they have a known side effect profile of acidity. They can also cause renal stones, which are side effects that you can possibly have on ketogenic diet. So if you use those medications in combination with ketogenic diet, then there's a higher likelihood that you'll have some of those side effects being compounded. I did a talk earlier on Fintepla. A known side effect of that is appetite suppression. And so it's not interacting with ketogenic diet per se. However, if there's a known side effect to certain medications while being on ketogenic diet, it's important for your team to know so that they perhaps can make adjustments to your keto diet. Okay, true or false? I can get the keto flu. True. So I literally had to Google this because I was like, what is a keto flu? And it's the common complaints of people adapting to a ketogenic diet. And I guess I have never described it as a keto flu because we've mentioned this before. Typically, when you are initiating a ketogenic diet, especially in small children, it's done in the hospital to manage the side effects of switching over metabolically from a carb-burning metabolism to a fat-burning metabolism. So all the side effects that you would assume would happen in that time, like hypoglycemia or low blood sugar, or maybe some acidity or acidosis, that can happen in that metabolic switch. And so when I Googled keto flu, it sounded like a lot of the side effects that we manage when a person is admitted into the hospital to manage the initiation of ketogenic diet. So some common complaints are nausea, vomiting, constipation, headache, irritability, weakness, stomach pain, which can happen when you're rapidly switching your body over to this different form of metabolism. And Rebecca had alluded to this earlier. Some of the initiations we're doing outpatient, and we do it over a very long period of time. And the reason for that is we want to try and mitigate some of those side effects as you're switching over to a fat-burning metabolism. So the answer is yes, you can get a keto flu. I would say that the number one thing that we would look out for is hydration, making sure that you're well hydrated, but also that you're managed by a team that's experienced and knows what to do. Because sometimes it may just be that there's a calorie deficit. Maybe you're not getting enough calories, and that's part of the reason why you're hangry and irritable. And your team would then manage the amount of calories that you were receiving. So it's important to note there are side effects to ketone-producing diets. Again, it's not a physiological diet, therefore there are side effects. And some of the acute side effects while we're switching over is dehydration. And so we encourage all of our patients to maintain hydration. There's a certain fluid minimum that we require patients to meet before actually starting ketogenic diet. And part of the reason for that is we want to, again, mitigate some of those side effects. Hypoglycemia can happen in that switch, right? Just while we're trying to get that ratio correct, that blood sugar can drop, which is expected in a low-carb diet. Usually our patients are somewhere between 50 and 80 milligrams per deciliter. That's pretty low, because for those of us that are not on a keto diet, 80 might be a typical fasting blood sugar. But for those folks that are on a keto diet, that's the range that we're looking for. Of course, they can certainly fall below that range, and if that happens, then that means that we have to make some changes to the ratio. Some lethargy or acidosis might occur. This diet is very acidic in nature, and so as you're switching over, your body might become very acidic. And then lastly, but probably what's most common, is gastrointestinal symptoms. So this is a high-fat diet. If you are already predisposed to reflux or constipation, some of those GI side effects, it's important to let your team know, because certainly as you switch over to a fat-burning diet, it can exacerbate those side effects. Other side effects are weight loss. So again, the intention is not for calorie restriction. We don't want our patients to lose weight. We want our patients to maintain weight. And oftentimes in our smaller children, if we notice that there is any weight loss, we will try and replace those calories, because we want them to maintain adequate growth and development. Other potential side effects are high levels of density lipoprotein, elevated total cholesterol. So, with some of our adult patients, we will screen to make sure there isn't a pre-existing condition where there's higher cholesterols, and then we check every 3 to 6 months thereafter to make sure that those levels even out, and around 12 months time, they typically do. And it's something that we work with our patients at looking at that side effect profile. We certainly have had patients that have had really high triglycerides and total cholesterol, and we came to a point where we were looking at the seizure control versus these values, and some folks felt that then that they required a statin. They were co-managed with our lipid panel team because their seizures were so well controlled. If we lower the ratio of the diet, then they can have a reemergence of seizures. So those are some of the things that we're looking at and we're managing as a team. Lastly, potential side effect is renal stones. And the number one way to prevent that from happening is to maintain that hydration, drinking the minimum amount of fluid that's given to you by your team. So what we do is we check lipid panels and monitor with surveillance labs every 3 to 6 months while on diet therapy. And then we also check urine also, so that we identify any potential side effects that are associated with diet. Again, to mitigate some of those acute side effects, we require a hospital admission. So true or false, I can get a keto rash. So the answer is unlikely. However, I too had to Google this because I was like, what is this keto rash? I've never seen this keto rash. And I had asked Rebecca and Sarah as well, have you ever seen this in actual practice? And so, when I looked this up, there were studies of this very rare condition called prurigo pigmentosa, and it's an inflammatory skin condition that can appear with carb and calorie restriction. And it's been described in the literature in a very specific type of person. And usually there's some sort of underlying metabolic condition that leads to this inflammatory skin condition. What's even, something that I pay attention to more so in my patients is if there are any potential food allergies or sensitivities, because perhaps the rash may not actually be this rare inflammatory condition, but they might be having some sort of sensitivity to the food or formula that they're receiving. So that's something that we check with the team. If you have any sensitivities or your child does, it's important to notify your team so that they can take note of it as they are creating the diet.
All right, this one's kind of a freebie because Beck really already went over this. Nutrition supplements are necessary on the ketogenic diet. True or false? True. So the diet is not nutritionally complete, and this is why we tell families that they should not be on the diet just because their child is on the diet, because someone needs to also medically supervise you. You'll get your recommendations of your supplements from your dietitian, and they will make sure that they are low in carbs. And typically we recommend a multivitamin and a calcium supplement. What about other supplements? So I have a lot of families that started their own supplements just from the research that they've been reading, and this is something that you guys need to talk to your providers about because there might be some interactions with those supplements with your child's medical therapies. And I want you guys to remember that supplement labels are not FDA regulated, so there's no really like police that's making sure that everything's accurate, and even though it says that there's no sugar in there, we don't know for sure. This is Beck's.
So, a couple of years ago, I did this talk and somebody had asked me, what about ketone esters? And I was like, I don't know. And the answer still is, true or false, I can take ketone supplements instead of doing a ketogenic diet. So, the answer for now is false. I mean, the mechanism of action for a ketogenic diet isn't completely understood. This is certainly something that's being studied. Can I replace the keto diet with a pill? Why can't I just take a pill? And it's very complex, right? Metabolically, like what exactly is going underlying that's causing the seizure reduction? What we do know about these ketone esters is that they can momentarily boost ketone levels in the blood. So they can certainly cause a spike. The three ketone bodies that we had spoken about, beta-hydroxybutyrate, acetoacetate, and acetone, are found in your blood, urine, and breath. And taking ketone esters might momentarily bump those values up. But really, with nutritional ketosis, when you're doing a ketone-producing diet, we are sustaining those levels throughout the day, and really that's what's thought to actually control the seizures. And so research still continues whether or not ketone esters can produce the same types of seizure control that you see in a traditional ketogenic diet.
All right, I do get this question a lot from my patients. True or false? With increasing popularity of ketogenic diet, meal services are available and can be used to successfully be on this diet. True or false? False. So I wanted to kind of go over all the meal subscription services with you guys. So these ones are definitely a no. So they're low in carbs, but they're actually high in protein, which remembers keto is low in carbs and high in fat. So Home Chef, they do have a keto label, but their meals are really high in protein and their calories are really, really high. So this might be an issue when you're giving this to a child. Factor, they do have keto labels, which they kind of went around and also paired all their keto labels with Protein Plus. So that also tells you it's low in carbs, but it's high in protein. HelloFresh actually does not have a keto label. They have a carb conscious label, which I think is very accurate. And the last one is Tempo. So they do not have a keto label, and they do state that their meals are high in protein. So all of these are not appropriate for keto. But there are some hope. So Green Chef and Eat Clean is actually pretty close to a ketogenic diet meal. So some of their meals are either a 1-to-1 or a 1.5, which can definitely fit in your modified ketogenic diet. And Eat Clean has an additional benefit that has good portion control, so your calories are better controlled on Eat Clean. However, the pitfalls for these two is that their keto labels are not reliable. Because I did check some of their recipes. Some of them are 1-to-1, some of them are 1.5-to-1, but some of them are also not ketogenic diet friendly. Some of them are high in protein. So you kind of have to really be careful and select the recipes correctly. And as the last one, it may fit into a modified Atkins, but sometimes adjustments will still need to be done to kind of bump up that fat that you need for the day. Okay, last one. I have already tried ketogenic diet and it did not help with seizure control. Is it worth trying it again? Yeah?
Yes.
Okay. All right, so the answer is depends. So how did you try it, right? Did you try it with your epilepsy team? Did you have a dietitian to help you? Did you get an admission? And were you consistent on the diet? Did you have fries at night because you didn't have any carbs in the morning? Or did you have a birthday and need to have cake? So, and then we also wanted to know how long were you on it. So we typically ask for a commitment of 3 months from our patients, and those 3 months needs to be consistent. I think at the end of those 3 months and you don't see an improvement, you can safely say that you've tried the diet. Lastly, I want you guys to talk to your team, because they're the ones who are know you best. They know whether or not the diet was sustainable for you, and that's also a key important piece when you're determining whether someone can be on the ketogenic diet. All right, so tell me your questions. So we do have a little goodies if you do have a question. Go ahead.
Aside from those prescription services that you mentioned, my son is on the ketogenic diet, and we have found a lot of support in meals that are medically ketogenic friendly through like Kingbrook's Pharmaceuticals, or we used to use keto cuisine, which my son loved, but during the pandemic something happened. They weren't making it anymore, and I can't seem to find that ketogenic flour. I don't know if they're just stopped making it. So are there other resources that you guys know that families like myself can kind of find some support in?
So meal kits, I don't. Canbrook is a good source because they have Keto V Cafe, but a lot of those are more treat-like than they are like healthy, nutritious meal that you can have every day. For me, in my clinic at least, I collect different products that I see on the market that are low in net carbs. So those I'll give out to my patients. Like if you're craving bread, these are the list of breads that are lower in net carbs, or crackers or chocolates. So I do the collecting. I'll have Sarah kind of speak on what she does, and Beck too.
Regarding the keto cuisine, I had trouble with that with some of our families too. During the pandemic, it just seemed that they stopped producing it or they got backlogged. I haven't seen it come out since. With some of my families who use it in baking products, I've used the Keto Cal powder. So Keto Cal has a 3-to-1 powder that's unflavored, so that can be pretty good in helping increase the amount of fat in your recipes. And then the 4-to-1 powder is vanilla. So for sweeter baking foods, that could be beneficial too. Other than that, I think there may be a couple low-carb flours out there, but I haven't found the best one yet because they're typically higher in protein too. So it's all about weighing the pros and cons. But I've definitely used Keto Cal powder in baking recipes. Yep.
Any other questions?
Any other questions?
Comments?
Go ahead.
Yes.
Katie.
Go ahead.
It's her birthday tomorrow.
Happy birthday!
Avocado.
I have a question.
Yes.
Can you explain a little bit more? One of those guys talked about macros, the 1-to-1 and 1-to-2. Could you kind of elaborate on that, like what you're talking about and how you're calculating?
Yeah, of course. Was it the modified keto diet? Is that the one you're asking about?
Yes, I think it was the one in the middle.
Okay. So the modified keto diet is basically prescribed in a ketogenic ratio, like the classic diet. So the first number of your ratio is going to be the total amount of fat. The second number is the total amount of carbs with protein. It's typically done at a lower ratio, so a 1-to-1 or a 2-to-1 ratio, and then it uses the same same charting skills as the modified Atkins, where we teach our families to use different phone apps like Carb Manager, Chronometer, MyFitnessPal, so that they count all of the macronutrients. So they count the total amount of fat, total amount of protein, and total amount of carb, which describes the ketogenic ratio that they're on. So that one in comparison to modified Atkins families are only counting carbs, net carbohydrates, versus modified keto, they're counting all of their fat, all of their protein, and all of their carbs. Did that clarify your question?
Can you say that last part again?
Yeah, so modified keto, they're counting all of their macronutrients. They're counting fats, they're counting protein, and they're counting carbs. Yes.
Oh, go ahead.
We'll go in the back first.
Have you ever worked with patients that have seizures due to like a lesion, such as a tumor? And does a keto diet would help those types of patients?
Sure. So the question is if there's some sort of there's epilepsy that's associated with some sort of focal lesion, whether or not keto can be effective. So certainly, and at our center, we have worked with those types of patients. Maybe the lesion was not in a resectable area of the brain, and certainly if you have a child that is still experiencing seizures, then they can be placed on ketogenic diet as additional neuroprotection, just like any of the other types of therapies.
Have you seen success?
In combination with other anti-seizure treatments, we can get pretty good success with that. We consider it as an additional therapy, right? So instead of being on several medications, it might be one medication and ketogenic diet on top of it. But certainly we've seen it in our patient population.
Did you have a question?
And again, just trying to seek out other resources. I know that you mentioned the Charlie Foundation for recipes, and I know, these diets are so very individually tailored, but just to get some ideas, because we kind of, at least for my family, we kind of get stuck in this rut of the same recipes, and my son gets tired of them. And so just trying to be creative and get other ideas. Are there other recipe books or places that we can go to for inspiration or ideas?
Not to repeat back the Charlie Foundation, but they do actually have cookbooks that you can purchase too with more recipes than what's available on the website. Do you know this?
I know a dietitian from another hospital creates a Pinterest board.
Mm-hmm.
So there's keto-friendly recipes, so you can follow her board. I do not remember her Pinterest account, so I will let you know after. And what else? Matthew's Friends also have a lot of recipes, so I would go there too.
I'm gonna call out Debbie. She's this incredible parent that I have that she makes, and she's sitting right there. She makes the diet so palatable for her daughter, and every time they come to us, I mean, I'm not the dietitian, but whenever I hear them interacting with our dietitian, I'm like, every single thing that they make sounds so incredibly delicious. So sometimes it's reaching out to other families that have really great recipes. I'm sorry, now people are gonna find you. But do you want to share with us like some resources that you and Mark look up, or ideas? Because I think that you've come up with these things on your own.
Well, I'm happy to talk to anybody afterwards, but my husband does the shopping and the cooking. I have to give him the credit. And he just really likes to grill a lot of meat. So most of my daughter's protein comes from meat proteins. And he makes something called Martha Stewart sauce, which is kind of revised. But it's basically a mayonnaise with no sugar in it. You get it from Trader Joe's. He adds either avocado oil or olive oil to it. Thins it out, and then he adds paprika. And it sort of ends up on the hamburger, it ends up on the asparagus, it ends up on everything. And it's an easy way to add that fat every day. It's very tasty. But I'm happy to talk to anybody afterwards. We tried to do it without medical help, and we were kind of, up and down with the ketos, kind of coming from out of ketosis. And with the medical help, we're like really leveled out and have reduced the seizures tremendously. So
I don't know if you checked out the Hope Foundation.
That's great.
It's based on the East Coast out of Charleston, South Carolina. So it's just like Matthew, or just like Charlie's Foundation on the West Coast, but it's the East Coast version.
Thank you, that's great.
Beck, speak up. Regarding Keto Hope Foundation, they do have peer-to-peer families that they connect you with, and basically if you go on their website and you fill out their form, they're going to reach out to your primary dietitian to verify that you are a patient of theirs, and then from there they'll connect you to families. They also have kits to help get you started too if you're below a certain poverty line too, so they have a fantastic blog with different recipes.
Yeah, the dietitian on the board used to be my dietitian, and she left the hospital for better paying.
Was it Laura?
Yeah.
She's wonderful. Any other questions? Yes, in back.
Is there, I know that a lot of the medications cause lactose intolerance. Does the ketogenic, do they work around that as well?
Yeah, so is this regarding the different types of ketogenic formulas
Yes.
available? So ketogenic formulas are actually lactose-free baseline because they're already a standardized formula. So that shouldn't be a major problem. If you or your child's eating food, then we can definitely work around dairy-free or low lactose options for you too. Our colleagues, we were just chatting, another option too, if the patient or child has a feeding tube, we can use blenderized diet, so we can make our own formula with different real whole foods, and that could be also dairy-free as an option too. Any other questions? Yes.
You spoke about multivitamins and how important that is. Is there like your go-to multivitamin that you usually assign to families?
Great question. I usually have a few up my sleeve. I'll talk about mine and then I'll pass over to Rebecca. I like Nano VM, which is a powdered multivitamin. There's also just Centrum Adults tablet multivitamins too. And then there's another brand called Kirkman that also makes tablet multivitamins. All of those are pretty low in carbs.
She basically listed all my multivitamins, but for kids who doesn't take tablets, I do Flintstones chewable too.
I think there's also a powdered, I think it's orange flavored multivitamin that you mix with water. It's for older children and it's called Fruity Bites. I think there's also another one called Flexi Bites too. Flexi Bites with a PH for that F part of it. Yeah.
Did we have a question? No, I think that covered the vitamins. Did you have a question?
It's just really more curious for the option that you work with the breastfeeding. Would the mother need to be on a ketogenic diet?
That's a great question. I guess I'll go for it first.
Answer from this.
Okay. So I probably had one mom that was put on the ketogenic diet, and it was really a family discussion for what's the most important and what the most feasible things are for them. Because for them to be on the ketogenic diet too, they need someone to monitor all of their labs, order different things, and they need someone to be treating them too. So it's very complicated. It can be done, but it takes a whole team to do it.
But is it beneficial for the whole overall?
I don't have research studies per se, but I do know that that particular mom, we were able to analyze her breast milk from before and after starting her on the ketogenic diet, and she did have an increased fat content in her breast milk. We weren't able to analyze any micronutrients or how, if there were ketones in the breast milk or anything, but we did see an increase in fat.
I think that that's kind of a discussion that a family has with their care team. I mean, historically, we would say, gosh, that just makes creating the diet so much more complicated, but I think that breast milk in the recipe is so important to certain families, and so we want to take into consideration what's most important to families. So if we have a mother or a family that's really interested in incorporating breast milk or breastfeeding somehow into the ketogenic diet, then that's something they can work one-on-one with their diet therapy team. I will say that it can be incredibly challenging to do that, and so that's certainly a long discussion that we have with the family before we decide to pursue that route when initiating someone on ketogenic diet. Any other questions, comments? Are we all going to go out there and start ketogenic diet? Perhaps. Well, we're all here. One more question.
I did actually want to ask. I came in on the later half, but is there any renal impairment on the keto diet?
So it could cause side effects such as renal stones because the diet is very acidic in nature, and so there could be like higher levels of calcium in the urine if you're on a ketogenic diet. So hydration is most important, but if it's persistent, then we will give some citrate preparations to manage the renal stones that could be associated with keto diet. And I certainly have had patients with renal stones, and they didn't stop the diet, but we did have to work closely with their urologist in managing the keto stones. The renal stones. Yes.
So you mentioned earlier about statins and high cholesterol in keto. I know where I'm at. My cholesterol has been high for a long, long time on diet, and I went to go see the cardiologist. I go once a year with the keto team, and they started doing CT scans of the heart for a calcium score. And they said as long as it comes back normal, that not to even treat with statins because of just the risk of so many side effects.
That's true. I think that
I don't know if that's going to be a new standard.
Yeah, that's certainly something that we're looking at, CTs or MRIs, to check to see, well, what is the composition of those LDL cholesterol and whether or not it's actually harmful. That's something that we're certainly looking at. Obviously, if you have those side effects, high cholesterol or high triglycerides, then you work with your team to decrease the amount of saturated fats or maybe decrease the amount of animal fats that you might be taking before we pursue statin type therapies. And certainly that's a ongoing conversation with the team as well as the other specialties that are helping to treat that. But yes, we're looking at it. Oh, okay. Great. So I think we are going over our allotted time. It was great to see all of you. Enjoy the rest of the event. We'll be walking around if you have additional questions.